Yeah.
So, all right, so we're live.
Of course, yeah. I should have, in fact, earlier today okay. We're like officially live.
Not just yet. No, I'll tell you when we're live. We're live. Right now, what they see is a screen that says starting soon. It's a banner of the little poster I made for this. And then in a second, I'm going to click.
Oh, got it.
I'm going to start the countdown. And then once I start the countdown, they'll see 2 minutes. So I'm going to go for the countdown. There we go. Now, countdown. And now that it's counting down 2 minutes, I'm just going to quickly go live on my story and say we are live. Okay, here we go. We are now live. You all are seeing that we are going live in a minute and 38, 37, 36. Look at this elaborate setup. I'll need to show this to you guys when you're done seeing, but we're live. Go ahead. I will redo those.
I mean, the other option is just share your stories with Zoom meeting. We just say just give them the Zoom meeting, because I think by the time you get all that done, we'll have barely an hour for the actual thing.
No, that's fine. They'll just know to follow me on Facebook. They're already following on Facebook and those platforms.
Oh, got it. Okay.
All right, so we have 10 seconds. The links are broke. I'll provide new ones. Just follow on YouTube for now or Facebook.
Oh, so which links are broken? What do they mean?
Oh no, the links aren't broken. Just my swipe up thing that I provided is broken. But now here we go. We are actually live. So ready for me to welcome you on? All set?
Yes.
Okay. And we are live. Here we are. Hi. Coming to you live from my bed, actually, which I'm trying to disguise it to make it look like an office, but I think I've failed. And welcome back to the podcast, to the broadcast, Dr. Priyumvada Naik. How are you doing?
Hi.
Good, good.
I'm good. I'm still alive after my first vaccine.
Oh, wonderful. Now, your first vaccine was how long ago? Was it a week ago?
It was on the 28th, exactly.
28th. Okay, so can they track you now? Bill Gates is tracking you everywhere you go, right?
I mean, well, I hear that the 5G doesn't activate until the second.
Oh, so you're going to get 5G.
No, I'm just kidding. For anyone who's watching. Yes, I had a friend.
Uh-oh. Are you with us? Oh, we can't hear you.
Sorry, I hit mute.
There we go. Now
is
you're
that
back.
Better? Okay.
Perfect.
So a friend of mine who is a physician and has been seeing my very sarcastic post was like, you need to tell people you're being sarcastic, because someone is going to believe all of this nonsense about chips and all this other stuff. So with that, should we just jump in and talk about this?
Yeah, let's go for it. I think we may I think we'll give it a moment as people are filtering in. That's why we did the 2-minute intro. So I think people should be here now. So if y'all are watching, whether you're watching on Facebook Live or YouTube Live or Twitch, or if anyone actually uses Periscope, you can comment. I don't know if you can see your own comments, but you will be able to see our comments. So, and I'll be able to type back to you. Dr. Naik won't necessarily see the comments, but I'll be reading them to her because she's not watching the same screen you're watching. She's watching the Zoom that we're on. So if you have comments, go ahead and comment in, and we'll read those out. Otherwise, you can also just message me at Honey LaBronx on just DM me on Instagram if you don't know how else to submit a question, and I'll get those. But yeah, so do you wanna start off by giving us any sort of update before we jump into questions?
Yeah, I mean, so right now the biggest terrifying thing is that because of all the holiday travel, we are now between Thanksgiving and Christmas. The Christmas rush hasn't actually even started yet. This is all still the Thanksgiving rush, and we're seeing hospitals in Atlanta. So generally speaking, in the winter, we often go on diversion at least once or twice a week in the hospitals. And diversion means there are no beds in the hospital, so anyone coming via ambulance to the ER is diverted
elsewhere
to another hospital.
Yeah.
Every once in a while, a couple of years ago, there was a really bad flu that we just missed the boat with the vaccination. The vaccine was not as efficacious that year, and so a lot of people were getting the flu, even getting it severely enough that they were coming into the hospital. Not even necessarily to be admitted, but they might need IV hydration and then they'd go home. And that was the first time in a long time that literally every hospital at one point was on diversion. And we make do, so what that means is patients are sitting in hall spots in the ER and they're admitted to the hospital. If you work in a place like Grady Hospital, which is our large county hospital, fairly routine to round on your ICU patients in the ER because there are no ICU beds available.
Yeah.
But what's happening right now is usually places like Grady and then Piedmont Atlanta's and other large hospital, these are sort of the last bastions. So those guys usually are not on diversion when the other hospitals go on diversion. And right now, there was a day where literally every hospital was on diversion. In LA, the hospitals are completely full. So like one of the things that's happening in some of the hospitals here is they're shutting down the cath lab, they're shutting down the PACU, which is the post-acute care. So you've had surgery, you're recovering from your surgery in the PACU, and at that point, someone makes an assessment, okay, they're well enough to go home, or no, they need to be admitted, or whatever the case may be. Those are being shut down. Those are being converted to ICU beds. Northside Hospital in Atlanta opened up a new wing that had something like 60 or 70 beds, and a friend of mine who works there as a physician told me they filled it in 3 days.
God.
And that was last week. So if you look at a place like LA, I'm seeing things that are saying, and I need to confirm this, but I'm seeing things that are saying, if you have a cardiac arrest, if you have a heart attack for any reason, and you're in an ambulance and the EMS guys are not able to get your pulse back before you hit the doors of the hospital, they will not be able to take you in the hospital because they don't have room. The ambulances are lining up. A friend of mine in Atlanta, her dad was diagnosed with COVID. He was requiring oxygen. They took him via ambulance to the ER to be assessed, and he sat in an ambulance for 3 hours before they could get to him.
So that's true then, that thing that's circulating online that
So that's the latest, and it's because. Well, I don't know about the LA one. I need to confirm that with my friends that live in the LA area. But I can tell you, it is true, at least in Atlanta, the ambulances are lining up and being told you have to wait. We don't have any room in the ER for these folks. They're being triaged in the ambulances. Now, obviously, if someone is critically ill and they have a low blood pressure, they're not sitting in an ambulance for 3 hours, right? Because of what's happening. But I think what people don't realize is, in an ICU, for example, studies have shown that the ideal patient-to-doctor ratio is 12 to 13 patients to one doc. Mm-hmm. Now, in the winter, occasionally we'll have 20, 25 patients, and that's pretty busy. And that, when we start to have that many patients per doctor, we're not really able to spend the time we want with the patient. We do a good job, standards drop, but that's spending longer in the hospital. It takes longer to get through the patients, so that means that the risk of medical error goes up. But the other thing that happens is if I have 10 critically ill patients, I get to spend a lot of time with each patient, which means I'm not just putting out the fires on that patient. I'm able to go, this is the goal for today. What are the goals for the next 3 days? And let's start implementing the 25 patients. I'm like, how do I keep this guy alive? How do I make sure that nothing's going on? What do I need to check in the afternoon when his labs come back? And that's about it. And then I got to move on to the next patient.
Yeah.
Right? Because from a time standpoint, that's just all we can do. And there just aren't enough critical care docs and docs that are trained to do this. So like in Italy, for example, when the pandemic first hit, they were handing doctors like cheat sheets on how to manage a patient on a vent. And in the early days here, I was hearing from some of the companies that hire physicians to go to other hospitals, and some of the hospitals were just going, look, if you've ever been in a hospital and laid hands on an inpatient, we'll take you. We'll figure something out. In New York, they had medical teams where your medical team would be an ICU doctor and like a urologist and resident, right? So it's really important to understand it's not just about do you get the hospital bed.
It's about who
do you get a critically, a critical ICU bed. It's who's taking care of you.
Yeah.
Right? And how many patients does that doctor have? And that's where we are right now. And we are there because people chose to travel. And people are still not locking down, like we aren't misinformation, right?
Yeah.
And doctors are, so, I mean, the burden for physicians has become insane. So not only are they taking care of patients, I have colleagues who are in therapy right now. They are seeing psychologists because of what they're doing every day, deaths that they're seeing every day. And having to be the person to hold someone's hand when they die because their family can't come see them.
Yeah.
Right? So you've got these traumatized people doing the best they can, right? And then on their drive home, they're seeing the bars open and they're seeing posts on Facebook about going to parties and, hey, it's my 10-year anniversary. I want to go and sit down in a restaurant and eat because of the economy. And it's like, well, you're being a little disingenuous. You can help the economy by getting servers like you were if you were dining in, right? You don't have to dine in to support restaurants, right? So it's very frustrating for us. It's very frustrating for physicians to kind of see that happening. But, obviously physicians are still going to do what physicians have to do, but I think there's going to be a reckoning after this. I think physicians after this pandemic is over are going to say, is it worth it?
Worth it what? Worth it to go...
Is it worth doing what I'm doing when my life is actively being endangered?
What, like worth going into medicine at all?
Well, continuing in the same field, right?
Yeah.
So I'm part of Facebook groups where people are like, hey, what's a non-clinical job I can transition into?
So I hadn't even considered that. Like this is making people, the people who are taking care of us, it's making them not want to be the people who take care of us anymore. That's grim. And I'm sure if you saw my my Instagram story, I mean, people traveling for the holidays, that's not I don't want to say that I can understand because that's not, I can't understand that. It's been 9 months now. We should all know no traveling no matter what, zoom, zoom, zoom. But on top of it, there's the gays going to Puerto Vallarta to go to these huge circuit parties where, I mean, it's like bodies packed in on the dance floor. Everyone shirtless, maskless, dancing, sweating, just doing whatever. And, you try confronting them, you try messaging them, and saying anything about it, and they're like, it's just not real for them.
Right. I mean, I will say that the misinformation and disinformation campaigns have been stellar. I mean, they've been incredibly successful,
Yeah.
right? Which is, you know, the very fact that I have to come on your podcast every couple months and dispel myths
Yeah.
is like just unheard of, right? We didn't have to do this when swine flu was around, right? So yeah, I mean, it's very frustrating. It's very grim. It's going to get worse. Yes, the vaccine is rolling out. I think what people don't understand is that the vaccine does not mean we don't mask and that we don't physically distance and that we don't stay at home. And the reason that we still have to do that is the vaccine is not a cure. People keep talking about the vaccine as if it's a cure.
Exactly.
People are also saying that the people who are promoting the vaccine are saying it's a cure. Nobody of any consequence thinks the vaccine is a cure.
Right.
Nobody of any consequence thinks that the vaccine is going to endemic. People are accusing the folks that are pro-vaccination of making that claim that the vaccine is going to prevent the next pandemic. Nobody of consequence is saying that. Okay? All the vaccine can do is it can dramatically decrease the chance that you get infected, and that if you do get infected, that you have severe illness. That is the goal, right?
Yeah.
But think about what that means. It means I've been vaccinated. I've gotten my first shot. I'm going to get my second shot in about 2 weeks.
Yeah.
Once I get the second shot, it's supposed to be about 95% effective. So if I get COVID, I can still get severely ill, but the chances drop dramatically. But it still means that I can get COVID. It's less likely, but I can still get it. And if I get it, I still got a quarantine.
Yeah.
Right. So I still, and remember, because asymptomatic spread is a thing, I can get COVID and not know that I have COVID and not have symptoms and spread it to somebody else. So
Yeah.
I still have to wear a mask. I still have to be judicious about what I do. You know, so, I was joking about the whole 10-year big anniversary, but my 10-year big anniversary was January 1st. And it was supposed to be a big blowout. I was going to travel. I was either going to go to Costa Rica or Prague or some place and just eat all the vegan food, right? And reasons: one, it's dangerous, but secondly, big anniversary celebrations are about me, and veganism isn't about me, right? I mean, that's a little bit of an ego. That's a little bit of me going, let me pat myself on the back for doing the bare minimum of what I should be doing, right? It's not like I pat myself on the back for not kicking homeless people.
Let me interrupt for just 1 second, just to say, I think on your phone, it's cutting out a little bit, but we can still hear everything that you're saying. It's just there's a little fast food drive-through speaker.
Okay.
So I'm wondering, could you try switching to the
Should I switch
other
back
one
to my
again?
laptop?
If you can, let me see if that fixes it.
Yeah.
So...
Okay, it may be my internet connection. I'm gonna stop the video for just a second.
Okay.
And I'm gonna...
Okay, so I just need to switch to her other feed here. So let me just wait for her to pop up, and then once I got her back, if this works better, we will switch to questions. Sorry for the late start, and sorry I'm a little scattered right now because I'm trying to scramble for a few things I couldn't get working before we started. So let me bring you back into the spotlight. There we go. So you're back, and then let me just have you unmute.
Is this better?
Yes. I have a feeling the connection's going to be better as well. It's certainly, I just need you to start by asking, hi, thank you for calling, how may I help you?
Thank you for calling the COVID hotline.
How can I help you? Why should we have to help you?
Right.
Yeah.
So, just in a nutshell, things are, on the healthcare worker side, things are grim. Now, I want to make something clear, because I think a lot of people are misunderstanding, and I definitely do not want to come across like I'm misrepresenting myself.
Yeah.
I am not seeing COVID patients, okay? I am doing ICU work, and I will, in the next couple weeks, most likely activate and start seeing COVID patients. because some of my colleagues have contacted me directly saying, we need a break. Please help us.
Yeah.
There are many reasons I'm not seeing COVID patients. You and I have discussed them. I don't really want to share them
Sure. Yeah.
publicly. But I am doing ICU work. I just happen to not be seeing COVID patients. But ICU work is ICU work, and I know what it is to be overwhelmed. I know, I have been in ICUs. I've walked through them. This whole idiocy of people taking pictures in hallways going, see, the hospitals aren't full. Right, no hospital is full right now because we are preventing all of the other stuff from coming to the hospital, right? So, first of all, I don't know why people think that the hallways are jam-packed in a hospital anyway, right? That's
Honestly,
a fire hazard.
though, when I watch that, because I'm a layman, I know I'm very, very smart, so it might surprise people, but I am a layman, so even I wonder when I see that, what is the explanation? Because someone like me, I see that, and I'm like, well, that's not congruent with what I think it would look like.
Well, so there's a couple reasons why it looks that way.
Yeah.
When you walk through a hallway in a busy hospital, a lot of the people you're seeing walking around are visitors, right?
Mm-hmm.
Family coming to see people. A drug rep might be coming to see somebody, right?
Yeah.
The cook rep might be coming to talk to me about the pleural effusion kit that he wants me to use, right?
Mm-hmm.
So it's going to be a lot of that. It's going to be family showing up with their loved one for an elective procedure, right? We've shut down elective procedures, right? So when you take a picture in a hallway, it is likely to look completely barren and completely unpopulated because we are dramatically stopping at the door who's allowed in. Now, no one is going to allow you to go into an ICU and take pictures of full ICU beds because that's a massive HIPAA violation.
And I mean, if I can't be with a loved one as they're dying, what makes you think like, oh, but you have a blog? Oh, right this way.
Right, exactly. So it's one of those things where I think people, you know the concept of object permanence, which is like when toddlers learn that just because you do this, just because you can't see something, it doesn't exist. So I think that a lot of conspiracy theorists have what I have dubbed evidence impermanence, which trademark pending, but to me, evidence impermanence is this idea that because I haven't seen it, it cannot exist.
Yeah.
Right? The number of people who are like, I haven't seen a patient with XYZ. Okay, well, I don't know anybody whose dad has been murdered.
Mm-hmm.
That doesn't mean that dads don't get murdered. Right? I can guarantee you that most people have not seen someone code multiple times in a night.
Yeah.
I have, and I have run those codes. So I know that exists, right? Meaning people have cardiac arrests.
Yeah.
So just because you haven't seen something does not mean it doesn't exist. And that is the challenge, is that we've become a world where we think that reality TV is real. And so therefore, if we can't see it, it can't be true.
I get this all the time where I tell people about my triple backflip where I can land in a split. And I was like, just because you haven't seen it, I got it. I'm not going to show you.
Right. But that's the challenge, is that, and then people, like I said, they're trying to go into these hospitals and they're taking pictures. So I went and I needed to see a friend of mine, who was a physician. She's a joint specialist. And she fit me in urgently because of my knee issues from running. And I walked in and the hospital looked like, one of those like tumbleweeds could have been rolling through the hospital, right?
Yeah.
And it wasn't because the hospital wasn't busy. It was because they had transitioned to, for example, 50 to 60% of their patients they were now seeing in telemedicine visits, right? So no one's sitting in the waiting rooms, right? So there's a lot of reasons why this isn't happening. Like I said, like elective surgical procedures are no longer happening. The ICU unit that I may be working in is a makeshift ICU because they've shut down the cath lab and the PACU. So how are they cathing people? Because people are still having heart attacks, right? So it's a really grim thing, and it's frustrating to me. The vaccine is a light for many of us because it means that we have given ourselves some protection. Yeah. But unless everybody does it, it's going to be a challenge. And there are reasons, I know one of the questions, so I'll just go ahead and address it. One of the questions is, why aren't healthcare workers and frontline workers getting the vaccine? Why aren't they rushing to get the vaccine?
Mm-hmm.
And I think there's two major reasons, is my sense. Now, this is my sense, this is my opinion, because I don't have data to back it up, right?
Mm-hmm.
And I don't like talking about things that aren't data driven, okay? In this case, though, we do know that there are two major factions, is what we're seeing.
Mm-hmm.
One is the conspiracy theory folks, right? Who are like, it's going to change your DNA and you're going to be tracked and 5G. And we're going to talk about all of that because those are questions that people have asked. So there's that group. But there is a large group of people of color, Black and Indigenous folks, who are understandably mistrustful of the medical system.
I'm glad we're going into this.
And the thing that people, like, I'm seeing a lot of frustration aimed at those populations, and the frustration really shouldn't be aimed at those populations.
Yes, correct.
The frustration really needs to be aimed at the medical community for not doing a good enough job of regaining that trust and then deserving that trust.
Talk about it.
Okay, so
yep.
So here's what I mean. So people think of Tuskegee as the only reason why African American folks may be mistrustful of medicine. No, that's just one of the many examples. Okay?
Mm-hmm.
In the 1960s in Atlanta, before Grady was desegregated, the only people that saw Black patients in the city of Atlanta were medical students.
Yeah.
They could not get the care of someone who had been through medical school and through a residency. Right? They were getting students who didn't know what the hell they were doing. Right? So yes, Tuskegee is a big thing, but there are many other things. The entire field of GYN advancements that have occurred in America have occurred because of experimentation on enslaved Black women. Okay? So there's a long-standing history of this. Now you add in the known biases that we know exist in medicine, right? Dr. Susan Moore is a perfect example. Now, I don't want to get into the weeds with her case. For the people that don't know, she's a physician who recorded on social media some of the negative interactions that she had at one particular hospital. Then she was discharged, and 12 hours later, she got readmitted to another hospital, became septic, and then shortly thereafter died. Now, I am the first to admit that there are some things about the story that don't make sense, and I am not saying that I don't believe her. What I'm saying is, I think she was likely experiencing some confusion because some of what she was saying was a little bit weird and off, and I don't think that that is a reflection of anything other than the fact that she was ill. And it's very hard to be like on the ball and on your game when you're critically ill wearing oxygen, right? There's also some things that aren't really clear to me because, again, we're getting the information third hand. But what is clear is this, okay? If someone is telling you they are short of breath, there's not really an objective test for that, right?
Yeah.
She clearly was still requiring oxygen. There are some things that she pointed out that don't make sense, like why were they telling her that she wasn't a candidate for remdesivir when she'd already gotten 2 doses, right? I think anybody with any bit of common sense can see that if you have been discharged from the hospital and you bounce back in less than a day, 12 hours later, you were discharged too soon, right? I mean, I have questions like, why was a woman who was clearly in her 60s, who clearly was heavyset, who was in the highest risk group, African American, on oxygen and had known lung disease, why were they not more aggressive? Now, again, I'm not a fan of this sort of backseat sort of critique because I was not involved. And I can tell you as a physician, I have had outside people judge me and my care because they don't understand the situation, right? Yeah. So I want to give the physicians the benefit of the doubt. That said, nobody needs a stat neck CT to justify needing pain medicines for their neck, right? The whole idea that someone would tell her, I can't give you IV narcotics because of your respiratory status makes no sense to me, because those are the patients that I would want to give IV narcotics to because the half-life is really short, and if they're going to have some respiratory catastrophe, I can give them Narcan and it'll reverse very quickly. And she's still in the hospital, so that is the time to give someone narcotics if you are concerned about it. But I do think, I agree with her, I think the reason reason that she was not given narcotics is because people assumed she was drug seeking.
She was what? Drug seeking?
Drug seeking, yeah. And we see that a lot. We know from studies that they have interviewed physicians and other healthcare workers, not just physicians. And it is not just white physicians or non-black physicians. Black physicians and nurses and healthcare workers do this as well. I'm sorry, I just got distracted because there's some animal in my backyard. Sorry.
Okay.
Okay.
Some animal that is not yours.
That is not mine. Yeah.
Yeah.
I think it's just I don't know what that was. Anyway, hopefully it was just a squirrel. Anyway, so we know from studies that they've asked people about pain tolerance in various ethnic groups, and a shockingly high number of people are under the misconception that black people don't feel pain in the way white people do. I don't understand how you could believe that, because there's nothing about pain nerves that would make that be true. Do you know what I mean? Like, there's nothing about the nervous system that is genetically influenced. So I'm not sure how anybody would feel that other than
Search me.
implicit bias and
Implicit
systemic
bias.
racism.
Handed down
Right.
through how many centuries?
Right. So it is, and I have gone and done consults on patients and nurses of all races, including black, have said to me, oh God, doc, this patient, she's just being really melodramatic. And I walk in the room and I'm like, I don't like hearing that stuff because I don't want my perception colored by what other people say. So I walk in the room and I'm examining the patient, and by every measure that I can look at, she has reasons to be very uncomfortable. But I'll give you one guess, one stab at 9 times out of 10 what race that patient is. Right? Well, I'm gonna clarify that. They're either black, Latinx, or they have an accent.
Interesting.
Right. So there's a lot of lack of culturally sensitive and culturally aware training in our system. And so a lot of times, I have patients who aren't necessarily born and raised in America who will describe pain in a way that's totally different than what I would describe pain as. Right? And so we have to, and this is why it's so important that we have physicians and nurses of all races and ethnicities and creeds and colors because of that, right? Working at Grady was eye-opening for me because while I had I had trained in Medical College of Georgia in Augusta, many of my patients were rural and white, and that was eye-opening for me. But once I was seeing predominantly African-American patients, I really had to learn a new lingo to some degree. There are words and phrases and descriptions of not just pain, but other symptoms that are very culturally specific. And I had to learn that, right? I had to learn how some Vietnamese Americans describe things, right? And so it is true that there is bias. And so going back to the original question of why would somebody not take a vaccine, that's why they wouldn't take a vaccine.
Yeah.
Right? And then you add to that the concern of, oh, we rushed it. Right? Because what were we all saying at the beginning? It's going to be 2 years before the vaccine comes out.
Yeah.
We weren't, and that is the normal course of things. What we weren't really anticipating is that
the whole world was going to stop.
Everyone was going to drop everything to work on the vaccine, right? Like, and it wasn't just the drug companies. It was clinical trials were happening at rates that are unheard of. People were willing to volunteer for clinical trials at unheard of rates. So as an example, in a phase 3 trial, a typical phase 3 trial is going to be anywhere from 2,000 to 5,000, maybe 10,000 people. Okay, the Pfizer trial had nearly 45,000 people in it. The Mrna trial had over 30,000.
Yeah, I was going to say, I remember hearing 30,000 people.
Right, so we have more people in these trials than we have ever had, right? Globally, governments have thrown more funding at these groups than has ever been done. So technology companies were turning their attention to this more than anything else. So it really was a situation where everybody rallied behind this one cause, and that's why we were able to get the results we were able to get as quickly as we were able to get them. A lot of people, I mean, I'm the first one to be suspicious of drug companies and their marketing strategies and all of that stuff, right? Especially as someone who thinks that half the medicines that we give people, if we were just able to convince them to change their behaviors, which can be challenging, we wouldn't need some of these medicines, right? But, and I definitely think the cost of medications is outrageous and obscene in this country.
Yeah.
But I will say that what a lot of people don't understand is that drug companies contract independent research organizations to do a lot of these trials. So they have independent medical monitors who are monitoring everything. People don't understand that when we talk about what's called an SAE, a serious adverse event, the definition of a serious adverse event is any adverse event that occurs to a person in a trial, whether you can prove causality or whether there is any relationship at all. Okay? So it's really important that people understand, like, people will go, well, I've read the package insert of such and such drug or such and such vaccine, and it says everything up and including death is a possibility. Right, but that's probably because somebody died in the trial, and it may have been totally unrelated to the drug that they were taking, but it has to be reported. It's kind of like, the analogy that I use is, if I give someone a lung transplant and they get hit by a car and die, that counts as a death against the transplant center, even though they died with a totally functioning graft, right? So it's an imperfect system, but the system exists in part because of things like, the Nuremberg trials, where we found out really what was going on in Nazi Germany with all of the experimentation that was going on there, right? That resulted in the Declaration of Helsinki, right? But with the Tuskegee trial, that resulted in something called the Belmont Report, which was, how do we prevent this from happening again? A lot of people don't understand that we have something called an IRB. So I actually, when I did a clinical trial in lung transplant patients, the IRB actually turned my trial down initially. It was a trial looking at alcohol use in lung donors and how did that affect the recipients. Did that affect the lungs that we were taking negatively, and then result in higher rates of rejection in the recipients because their donors had high alcohol intakes? And what we were wanting to do is we were wanting to give donor families a series of questions, a validated questionnaire about alcohol use. And the IRB was like, absolutely not. This is way too invasive. These people are grieving. And then we had to go back and explain to them, this is like the least invasive question they're going to get asked about their loved one, because they're going to get asked if their loved one did IV drugs. They're going to get asked if their loved one was male, did he have sex with men, right? Because those things have clinical implications for what we need to be looking for. So the IRB was doing their job. They were not doing something wrong. We just had to go and be clearer about what we wanted to do before we got permission to do this trial, right? So that's what an IRB exists for. A lot of people don't understand how clinical trials work, and a lot of people, understandably, if you don't trust the institution, why would you trust the institutional review board?
Sure.
Right. So I think those are the two populations. You've got the conspiracy theorists, and then you've got the people who are just hesitant. Either it's a combination of the vaccine came out too soon, or they might be Black or Indigenous or a person of color. I mean, if you're Indigenous, why would you trust anything that ever happens that the government does?
And that's one thing I've been trying to, there's just so many areas that incur my wrath right now that it's kind of like, okay, I'm going to pick and choose who I'm angry at. And I have a lot of friends who are saying crazy things. I have friends who are like, ugh, why do I see people in cars with masks on? Why do you have your mask on in the car? I'm like, who cares? That person probably doesn't.
No, I wore a mask when I was in my car because I'd just gotten an oil change, so someone had been in my car.
Yeah.
Right?
The point is,
and on my drive home, I wore a mask.
There's countless good reasons why you might wear a mask, but things like that I might comment on. But I'll see other specifically thinking of one friend of mine, and she's a Black woman, and she towards the beginning of this whole mess, excuse me, she and I talked on the phone, and she just needed to vent, and I was very clear that what she really needs right now is like 60 or 90 minutes of me just letting her get whatever she needs out of her system.
Yeah.
And I'm embarrassed to say, I've heard the word Tuskegee a lot. I know it had something, I'm embarrassed to even say this, I know it had something to do with hospitals and like medical experiments and something about aviation. But like,
basically what happened is the Tuskegee Airmen were allowed to get infected with syphilis, or they were injected, and then they were lied to. When they got sick, they were lied to, and they were not treated because people decided to use them to see what the natural course of untreated syphilis is.
Yeah.
Right? So untreated syphilis results, tertiary syphilis involves your brain.
Yeah.
Right? It can infect your spine. So it was horrific. It was absolutely horrific what we did. But let me remind you that the U.S. government also went to Guatemala and did clinical trials in Guatemalan citizens. Okay? So if you are somebody who comes from a country in Central or Latin America or South America, and you know, for example, that the U.S. government sent CIA operatives to teach torture techniques to people, are you going to trust what the U.S. government is telling you? You're not. But here's where we need to understand that the good and the bad of the government is that the left hand does not know what the right hand is doing, right? So there are different sections of the government, right? So the parts of the government that don't tend to have anything to do with politics, right? The NIH, right? I mean, yes, there's politics involved in it, but the NIH agenda has very clearly never changed, right? The CDC, we know, was suppressed in the Trump administration, so that's why I tend not to, I don't tend to use the CDC as my guideline as much, not because I don't trust the CDC, but we know that the CDC has been pressured over and over again by this administration, right?
Yeah.
So what I tend to do is, I recommend something if not just the CDC is saying it, but also the NIH and also our medical societies. So for me, in pulmonary critical care, it's the American Thoracic Society, it's the Society of Critical Care Medicine, it's the American College of Chest Physicians, the European Respiratory Society, the Thoracic Society of Australia and New Zealand. I mean, they're global societies, right? And they make recommendations based on the evidence. So if those guys are recommending things, that's what I tend to follow. If anyone is interested, they can follow the Society for Critical Care Medicine on Facebook. And they will post guidelines all the time in their news feeds, right? And so for me, that's really what it comes down to. But I can understand why, as a layperson, you may not trust it.
Sure.
The other thing is that people don't understand. You know, like, I just read this thing about some idiot OBGYN nurse who is like, the vaccine is fake and we shouldn't be taking it because the pandemic is fake. So what people don't understand is that A, all nurses are not alike, and B, nursing education is not the same as physician education, right? And C, you have to stay in your lane, right? So don't trust an OBGYN resident about infectious diseases.
Right.
Don't trust me about which is the better knee replacement to get. Right? So, I mean, I'm not going to tell someone, I mean, I can do my research, right? And I can do a lit search, and I can say, like, when my mom needed her hip replaced, I said, these are the questions you need to ask the orthopedic surgeon. But at the end of the day, he's the expert, not me. Right? The other thing that's happening is people are assuming that they know how to read medical literature, right? So there's that veterinarian who is just, I don't know if she was always this way, the vegan veterinarian who just posts nonsense on her page all the time. But she posted this article from this, it's not even like a news site. I don't even know what this site is. But what they basically said is, in a study of 10 million people, it showed that you cannot spread disease asymptomatically. That is not at all what the study showed. What they did is they looked at almost 10 million people in Wuhan, and after Wuhan, what they did is they looked at them before and after strict lockdown measures. Like very strict, real lockdown where everyone wore a mask if they left the house, right? And what they found was that only 300 cases of asymptomatic spread occurred. So that is not a study that is saying asymptomatic people are not a threat. That is a study that is saying asymptomatic people are not a threat if they're locked down and if they're wearing masks.
It's kind of like in theater, if someone, so I have a play I just put out there, and if someone came to my play, I can't think of something quick enough. If someone came to see my play from the New York Times, and they said, you know, Ben Strothman is a marvelously successful actor at alienating an audience, I could take the part of the quote that says, Ben Strothman is a marvelously successful actor. I can take that and quote it and put it on the billboard. I can put it on the poster, and they can't say anything against it. It's just funny how you can take these and spin them any way.
It reminds me of one of my favorite sayings, which is, when you take the text out of context, all you're left with is the comma.
Oh, that's so good. That is so good.
And so context is key to everything. So then you've got the people who are like, PCR doesn't work. Okay, yes, PCR works. I mean, I can't go into a big, like, I can't give everybody a bio. It's polymerase chain reaction. So it's basically RT-PCR is when we amplify chunks of DNA, because it's the only way, because DNA is so small, if we ever want to work with DNA, we need to amplify the sample. So it's, for example, if someone tests positive for HIV, the confirmatory test is a PCR test, right? Because we want to confirm that they actually have a viral load. So are there potential flaws to it? Sure. But what's happening is people are deliberately misunderstanding. So there was a guy that was recently put, and he's got a lot of followers in the vegan community. He posted this thing where Fauci had said, PCR is invalid after, you know, anything above 35 cycles. Okay, again, taken completely out of context. What he was saying is, let's say someone tests positive for COVID. We know they've got COVID. They've got the symptoms. It's very clear they're infected, right, with SARS-CoV-2, right? And initially at the outset, they test positive, whether you want to do the antigen test, whether you want to do the PCR test, whatever, okay? What he was saying is, there's this phenomenon there where the patient can no longer have symptoms, right? They've cleared their disease, they've survived it. It's now a month later. You can do PCR and still find chunks of the viral DNA and the viral protein using PCR, okay? And what he was saying is, if you run the machine 35 times, you'll be able to amplify it enough that even the tiny little residual bits that are in the system, you'll still be able to find. So again, taking it out of context, right? So that's the problem, is that when people who do not understand how science works start talking about science, it's like me talking about how to rebuild an engine, right? So it's really important that you look at the source of who is talking. And I would say that this is true of even the people that I trust and follow. So as an example, you know, a lot of people follow Garth Davis, and he's a really, really good guy. But I personally don't follow anything anybody says blindly, because I have the ability to read the literature myself.
Yeah. And that's one of the things I actually got blocked by someone who is a longtime Facebook friend simply because she said something about, like, I don't know if she said sheeple, because I think I remember her saying that, because it bothers me that she said that, because I'm like, you're vegan, why would you say that? Don't talk about sheep like that. But
what was it that she said? You broke up there.
Oh, she said something about, like, don't be sheeple, and then she said, do your own research.
Oh God, that's so speciesist.
Isn't it? But she said, do your own research, and I just commented, I'm like, please don't tell people that. You literally cannot do your own research when you have not had the education to be able to understand what you are reading.
Right.
That would be like me saying, you know what? Read the Icelandic sagas for yourself if you really want to understand, you know, Norse mythology. Well, they're written in Icelandic. Like, you're not, you can't.
But even if you understood Icelandic, you don't have the same cultural reference point that someone who was raised in that culture has,
Yeah.
right? So that's the challenge, is that people will read a study and they don't understand how to analyze the study. Like, I'll give you an example in the cystic fibrosis world, okay? So years and years ago, there was this brilliant study that came out that looked at inhaled hypertonic saline, okay? And everyone was like, oh my God, this decreases the rates of exacerbations in cystic fibrosis patients, and it decreases the number of times they go to the hospital. Well, I actually did a journal club on that, which means I spent an hour giving a talk about cystic fibrosis and all the treatments, and I thoroughly broke down that study.
Mm-hmm.
And the study is an excellent study, but there are some key flaws to the study. And one of those flaws is that the population that they were testing were not maxed out on current therapy. So the question is, did the hypertonic saline work in those folks because they weren't doing all the other things they should have been doing? And would they have not even needed the hypertonic saline if they were doing all the things they should have been doing, right? That's a very simple example of why it's important to understand how to read a trial, right? When we talk about the hydroxychloroquine trial, we talk about how the initial study that everybody thought was going to be this amazing trial, when we actually looked at it, they took people out of the treatment wing that had bad outcomes, and they said they were lost to follow-up, so that they could say that the treatment wing had good outcomes.
Yeah.
Right? That is not okay. Right? But if you just read the abstract, you're going to think this is like an amazing trial, right?
Sure.
So anyway, so we could go on and on and on, but I know that we've got a hard stop, so let's get to some more
and we do have
questions.
some questions. And because I love math so much, I did the math and I looked at, we have about 12 questions in about 30 minutes. So do you think we could kind of do a lightning round and give some
absolutely.
2-minute answers?
Yeah.
So our first question, I'll let you know when it's been 2 minutes, or I'll let you know when you got 30 seconds.
Okay.
And I hate timing someone when I'm the one who often takes forever. So here's a question: what actions can we take to protect the most vulnerable people in our immediate neighborhood, given we know that mask adherence and social distancing are increasingly failing in a population wary of extended isolation?
So I think, unfortunately, the answer to that is, why is it failing? Because it's not that the science is bad.
Mm-hmm.
We know that masks and isolation work. So what I would have to say, and this is just off the cuff, because there's no scientific answer to this,
Mm-hmm.
I would say if you have community members that are particularly vulnerable, figure out how you can help them stay in the house.
Yeah.
Get them their groceries, get them their medications, do those kinds of things. Is there a mask shortage? Are people not able to get access to masks?
Mm-hmm.
Right? Get them masks if you can, right? Make masks, that kind of thing.
Yeah.
What are some ways that we can minimize the number of times someone has to go out and be about, right? So those are the, unfortunately, what we're stuck with, other than changing the paradigm and getting people to trust the science behind masks.
Yeah. Good. Okay. Next one. This comes from Sup Nebraska on Instagram. Should this new variant of COVID cause us to avoid things like going to the grocery store, or do we know yet?
So there's a couple ways to answer that. First and foremost, it depends on how you define new. So it's new to us because we're finally testing for it. It's probably been here for a couple months at least.
Yeah. Okay.
Right? Minimum. Some people are saying it's been here since September, October. Okay? But the reality is, there's no way that this hasn't. The only reason we're hearing about it this week is because we're finally testing the strains when people are rapidly becoming infected. Okay?
Yeah.
So it's not that this virus is causing more severe disease, at least not right now. There's 3 major mutations to this particular one. It's like the B11 something or other.
B117.
Yeah, B117. There's 3 major mutations. One of them is to the spike protein, but there's no evidence that it's causing more severe disease. It's just translating to the fact that the virus is able to bind to the ACE2 receptor in our cells better and quicker, and so therefore people can get infected much more rapidly, right? So very quickly, this is a little bit of a tangent, but I'm seeing this meme that's like, why is it that people are saying that flu cases have gone down because people are wearing masks and isolating, but COVID cases are going up because people aren't wearing masks and not isolating, okay? again, context is key. The flu virus in general is not nearly as virulent and infectious as SARS-CoV-2 is.
Yeah.
Right? And that is the major difference. So even, like, I'm so glad about the whole mask thing that I'm like, why the hell have I not been wearing masks during flu season constantly?
Yeah.
Right? Because I'm always at risk of getting the flu. Right?
I'm suddenly like, why don't I always wear a mask? I mean, oh.
Yeah. I mean, I've always carried one with me. I keep one with me on a plane always, and I've been doing that since my lung transplant days because we used to make our transplant patients carry them on the plane, right? So if someone's coughing near me, it's not because the filter doesn't work. It's before the air gets to the filter to be filtered. If those droplets fall on me, I'm going to get sick, and I always get sick when I get off a plane.
Oh, yeah.
So I always keep a mask with me now so that if anyone seems to be sniffly or anything like that, I can pop a mask on.
Yeah.
Right? But the idea here, again, is that context is important. So with this particular virus, I don't think at this point there's no indication that we shouldn't go to the grocery store. Now, I know a lot of people do online grocery shopping or curbside pickup. I don't. I do go to the grocery store, but I am really only buying groceries for myself. So I can go buy 6 weeks worth of groceries and then not have to go out again.
Yeah.
I wear a mask. I stay the hell away from people who aren't wearing masks appropriately. I go when it's not crowded. So those are things that we should be doing anyway.
Yeah.
Make sure that you wash your hands, make sure that you're not touching stuff and then touching your face, because again, you can't get infected because someone coughs on a box of something unless you touch that box and then touch your face, right? It's not like the droplets are going to jump off the box and get you, right? So going back to your glitter analogy, that is literally the analogy that is in my head every time I leave the house.
Yeah. It's become a meme since, but I will maintain I came up with it, or at least I didn't see anyone. I agree with it. Yeah. I didn't see anyone share it before I said it.
Yeah.
Okay. Well, we have another question. We've got a question from Donna on Instagram. Is the vaccine vegan?
It is not. No vaccines are vegan. Part of what we call ICH-GCP, which stands for the International Conference for Harmonization Good Clinical Practices, unfortunately requires that all human trials start with preclinical trial data, and preclinical trial data involves animal testing. Okay, so all of these have been tested on animals. Many of them, these particular vaccines not so much, but other vaccines are often viruses that are cultured in like animal cells, like kidney cells of animals, or dog kidney cells, like monkey or dog kidney cells, things like that.
Yeah.
So none of them are vegan. These particular ones, similarly, there are no actual animal products that I've been able to find in them. By the way, this also means that there's no aborted fetus parts in them either.
Yeah, I'd love to touch on that.
So,
on why people think that.
Yeah, so, well, because some of the cell lines that were originally used to grow these came from embryonic stem cells from like 1960, 1970, right? But those cell lines are immortal now, so we don't need to keep using aborted, fetuses or embryos.
Wait, it's
not always aborted fetuses. Sometimes it's an embryo that was never implanted in someone.
So when we use embryonic stem cells, those are really like from way back then. They can keep regenerating.
No. Like some studies, like when we're doing neurologic studies and things, those are probably new embryos that are not being used.
Gotcha.
Right?
Yeah.
But we can get into the politics of it. Embryos are not sentient.
Yeah.
Okay. And most of the embryos that are being used are 2, 3, 4 cells, so they don't have like a nervous system, right? Anyway, so I've already forgotten what the question was. What was the actual question?
Whether it's vegan.
Oh, no, it is not vegan. However, it depends on how you want to look at it. Certainly the Vegan Society does not say that we should not take vaccines or take medication because they're not vegan. I believe it or not, I actually like the way that the Vatican worded this for once. And the way that they worded it was, if there is no morally irreproachable way to do something that will save lives, and we are forced to do something that is not morally irreproachable, fine, do it. But I think the answer for vegans is, if you have concerns, get the vaccine, but then throw in a couple dollars to the Center for Contemporary Studies. Donate some money to Aisha Akhtar's organization that is looking actively. They've created this center so that they can not only amplify the voices of alternatives to animal testing, but find other new technologies, right? And there are amazing technologies out there. Unless we start funding the groups that are looking for that, we're always going to default to the same stupid 1900 medicine model that we've been doing, right? I mean, it's a little bit like going, we're not gonna give people medicines because leeches work, right? If we only ever thought leeches would work, we never would have advanced medicine.
Yeah, and it's kind of like I'm so sick of vegans just pointing out, like, don't do that, stop doing that, tell me what to do instead, you know? It's like, rather than saying,
I mean, look, I mean, I get it. I get that there are times where we're like, you know, people are like, well, I'm vegan, but, you know, I was starving and the only thing at this restaurant was a burger. And it's like, okay, that's not really vegan, but okay.
Yeah.
I mean, I think that's pretty clear, right? This isn't about convenience. This is literally, is there another option, right? I mean, I drive on roads that aren't vegan.
Right. Yeah, perfect analogy.
Right? So I think it's important that, I think it's very, I mean, it guts me. It guts me to know that I have to do something that is not vegan. But I think we're going to drive ourselves crazy trying to be, and I hate the term personal purity because it's weaponized against vegans who, by people who want to be the sort of convenient vegan, right? The one who's like, well, you know, I'm not going to worry about whether my bread has duck feathers in it because personal purity, or, you know, I went to Taco Bell and they were out of potatoes and personal purity, right? Like, people weaponize that term, so I don't like that term.
That's a really good point. I appreciate that.
But I do think that there are times when there is not another option. This is the option that we have to go with.
This is one of those times.
Clearly. And let me tell you something. If you get vaccinated and you save yourself a trip to the ICU, how many non-vegan things are you getting in that ICU?
Oh my God, yeah. It's just, we don't think these things through. We just think, I'm satisfied with that soundbite. Cut it, print it, tweet it.
Yeah.
All right,
and please, like, whoever it was that asked the question, I'm not remotely suggesting that you're being argumentative, so I don't want you to think that I am attacking whoever it was that asked that question. I'm not suggesting that it's a bad question to ask. I think it's an excellent question.
I think a lot of vegans are asking this question just because we kind of have to, because we don't know what to say to people who keep bringing it up. I'm going to combine the next questions because they have some overlap. So, in general, what are the side effects of the vaccine, and to what extent are people getting headaches? Because some people are saying, you know, they get migraines and they worry that...
I took some notes.
Yeah.
So you're going to see me looking at some notes from the two New England Journal of Medicine articles.
Okay.
So let's talk about Pfizer first.
Yeah.
Okay. 43,000 participants. 10 people got severe COVID the day after they got the shot. 9 of them were in the placebo group. Okay. So it's important to understand when you get the vaccine, the first dose, it still takes about 2 weeks for your immune system to ramp up for that 50% efficacy.
Yeah.
And then the same thing for the second dose. The difference between the two vaccines, between the Pfizer and the Moderna vaccine, is the timing of your second dose.
Yeah.
So for Moderna, it's about 4 weeks, 28 days, and for Pfizer, it's about 21 days. And that's a little bit of a moving target. So, like, I think I'm getting mine on day 18 or day 17 because I didn't feel like coming in on a Sunday to get my shot.
Yeah.
Right? But as long as you're getting it within that window.
Yeah.
So, from a headache standpoint for the Pfizer vaccine, there wasn't a ton of headache occurring after the first dose. There was more of an issue with the second dose. So 52% of young people, meaning people less than 55 but older than 16 for the Pfizer vaccine, complained of headache. 39% of people over 55 after the second dose complained of headache. Now, when we characterize side effects, we characterize them as mild, moderate, severe, and there's a little bit of subjectivity to that, right? But to the best of their ability, what they found was that people who had severe systemic events, meaning something global, not so the vast majority of reactions are local, and that's what I had. My arm was sore, just my deltoid was sore where they had injected me. It was a little bit sore, like for a day, you know, when I would lift my arm and things like that. And then locally, it was a little bit tender, and that was it. That's the vast majority. But from a severe headache standpoint, about 2% of people after the second dose overall complained of headache. Fatigue was also somewhat common, about 4% of folks.
Mm-hmm.
But again, the most common thing is pain.
Yeah.
People can get fevers, they can get diffuse myalgias. We're tending to see that more after the second dose than we are with the first dose.
Mm-hmm.
So we don't know quite yet what the real world application is going to be, because this is all from the trial, right? With Moderna, let me see. With Moderna, headaches were about 0.9%. In the Mrna trial, and that was contrasted to about 1.4% in the placebo group. There's some other side effects that people have talked about, like a Bell's palsy, which is where you just have this isolated facial nerve paralysis. It's usually reversible, but it can take like months to years to go away.
Yeah.
It's a fairly rare thing, but you get Bell's palsy from being infected, right? I think what people don't really understand is how the Moderna and the Pfizer vaccines work. And I know that was a question. Do you want to pop up that image? And then I can talk people through it?
Yeah.
So the way that the Moderna vaccine works and the Pfizer vaccine.
Let me check something for 1 second. Let me just check something. I have a feeling when I set this up, I'm not sure if I set it up so that they'll be able to hear us while I do it. Give me 1 second and see for sure.
Okay. If you're just sharing the screen, it should be okay.
Well, it's a OBS thing, not a Zoom thing, but it looks like yeah, it's working. So they
now I'm not seeing it. Are you sharing it right now?
I'm sharing it, so they can see it, but we don't see it here in the Zoom.
Okay. So what you're looking at here is what we call mRNA translation. Now this is not, so bear with me a second. I want you to understand this, because then I'm going to talk about how the vaccine works.
Yeah.
So when we talk about, because people are like, oh, it's going to change my DNA. It cannot change your DNA. And the reason it cannot change your DNA is the way that mRNA works. So DNA is opened up. So DNA is 2 strands, right? It's opened up, and then mRNA comes in and makes you get a copy messenger RNA from 1 strand of the DNA. That messenger RNA leaves the nucleus and attaches to ribosomes, and then protein is made. So I'm going to give you another more basic one that I drew. This is the dry erase board that I use for my patients. Okay, can you read that? Is that like right side up for you guys? Because it's inverted.
It's right side up for us, yeah.
Okay, all right, so what we're looking at here is you go from DNA to messenger RNA. The messenger RNA leaves the nucleus, and then you form, through multiple steps, an actual protein. That's how this vaccine works. But the way the vaccine works is we're not up here, we're here. So the mRNA is injected into us. The mRNA never goes backwards. It never goes back into the nucleus. There's no reason for it to do that.
Yeah.
Okay? DNA never leaves the nucleus. Right? So there's no way that it can change your DNA. I've actually written that there.
Yeah.
Okay?
Yep.
So it's really important that we understand that these are pretty cool ways of using technology to, once you understand how cell biology works. So what we're doing with the messenger RNA virus is we're actually injecting artificially created messenger RNA from actual virus. So again, this is not actual virus. No one is getting virus injected into them.
Yeah.
Unless you actually get virus injected into you, you cannot be infected. Okay? If you get a piece of the virus that is not the actual virus, and it's not even so SARS-CoV-2 is an RNA virus. That's a different RNA. That's not messenger RNA. Okay? So I think that's confusing people too. Messenger RNA cannot infect you. The only thing messenger RNA can do is hang out with some tRNA and some ribosomes and create protein. That is all it can do. Okay? It can't go back into the nucleus or anything like that. So what
what folks have done is they've realized, hey, if we can design messenger RNA whose only job is creating one specific protein, which is the spike protein, which is the protein on the virus that is used to infect our cells. The idea is, if we're just injecting you with the mRNA, we're not even injecting you with the protein, right? We're injecting you with a code that then hijacks your own body. I shouldn't say hijack because that seems negative. That uses your own body's mechanism to create a spike protein that your immune system can then recognize. And the idea is the immune system recognizes the spike protein so that if you ever inhale the virus that has that spike protein on it, your immune system has already created a clone of B cells to start to go after that virus so that that virus cannot take hold and create a huge infection, okay? For some things like the Mrna vaccine, there's also some evidence that it may actually involve your T cell immunity. So it's a very long story, but in a nutshell, you got to have T cell and B cell immunity working together. But the first thing that happens is that the B cells produce antibodies. I mean, you need T cells for that to happen, but I don't think we need to go into antigen presenting cells and MHC complexes. I think that's a little bit too much information for folks. But once the antibodies start producing things, one of the things that happens is your T cell immunity gets activated and you start to produce a variety of different types of T cells, including things like cytotoxic T cells, which help to kill virus.
Yeah.
So, or virally infected cells. So the way that mRNA works, again, is that you're injecting mRNA so that you can produce a spike protein that your body can react to. You're not getting virus in your body. Here's the other thing that's important to understand about mRNA. All mRNA degrades after it's done. It degrades quite rapidly. Okay, all mRNA, including this mRNA. So it's not sitting in your body for months. Okay? So, and I don't mean that as like a facetious, I'm not mocking people. If you don't do cell biology, like, you're not going to understand that.
I'm just laughing because it's so wildly different from what people imagine.
Right. So you know, it's important to understand that the likelihood of someone having long-term side effects from this are pretty small. Now, what are some sort of long-term things that can happen? Well, we know, for example, from the flu vaccine that there's a slightly increased rate of Guillain-Barré syndrome in folks that are vaccinated versus folks that aren't. But here's what people don't understand. The rate of getting Guillain-Barré syndrome from the actual flu is much higher than it is from the vaccine, right? So the advantage to me of the vaccine is, even if I get a little bit of a side effect, first of all, Guillain-Barré is totally treatable, right? I mean, it's not a walk in the park, but it's totally treatable and reversible. Right? What isn't reversible is ARDS.
Yeah.
What isn't often reversible is kidney failure. Okay? Myocarditis, cardiac arrest, encephalopathy, right? Many of these things are not reversible. Many of these things if you survive them, if you're lucky enough to survive them, cause permanent disability, right? So again, in medicine, it's all about risk versus benefit. And the risk of this vaccine in particular is so minuscule compared to the risks from COVID. Now, I know a lot of people are like, oh, but I'm young, I'm not going to get it. Okay, well, we know that that's not true. We know that being young is not, I mean, you know, again, consistent data. Remember, we talked about the CDC Morbidity and Mortality Weekly Report in March. We are still seeing the same thing. We are still seeing a high percentage of young people being hospitalized. Sure, you may not die from COVID, but you may be someone who has this brain fog that we're hearing about. You may be someone who develops permanent critical illness myopathy from your ICU stay. You may be someone whose kidneys get knocked out because you go into septic shock. You may be someone whose lungs are destroyed. I know multiple people, right, because of my former lung transplant colleagues, are transplanting people right now for COVID. And let me tell you, the people that are transplanting are young. They're not transplanting old people. We don't transplant old people in general. And we don't like transplanting folks who are in the ICU on ECMO or on a vent, because a rapid eval is a setup for missing things. Whereas when we do things in a slow, deliberate manner, we have the time to think about things, right? But if someone is 22 years old and they're very healthy, other than this one thing, and they're dying of COVID, we're going to give them an option of a lung transplant. right? But a lung transplant is not a cure, right? A lung transplant means you're going to be on 20 to 30 medications for the rest of your life, 3 of them to prevent rejection of the lungs, and then every other one to prevent the side effects from the first 3. You're going to need to be biopsied a minimum of 7 times, just as surveillance to make sure that you're not rejecting your lungs. But anytime you have the sniffles or a cough, you're going to be coming in and you're going to get another biopsy. Prograf causes hirsutism, it causes shakiness, it can cause capillary leaks, so you get leg swelling. Steroids can make you go kind of nutty. It can cause you to gain weight. It can cause thin skin. They all increase your risk of infection. Cellcept can depress your immune system. Valganciclovir can cause significant cell depression as well. You know, you can be on Bactrim and have a massive allergic reaction to it. It can cause kidney disease, you know, irritation. It can cause your potassium to go up. So, I mean, I could go through all of the side effects of every one of these medications. So the idea here, again, is from a risk-benefit standpoint, what makes more sense? And getting this shot, if it protects me and helps to create herd immunity, makes sense.
Yeah. And I think people are forgetting that. I think people think herd immunity just means you go out and cough on everyone and whoever lives, we're now immune humans. Whereas,
I mean, that is technically herd immunity, but now you've killed 1 million people in order to achieve that herd immunity.
Yeah. Rather than just a certain percentage of us all having the vaccine so that this virus can't bounce around between that many of us.
Right, but that percentage is like 80%.
Yeah.
Right? It's 80 to 90% of people need to get this vaccine for us to achieve herd immunity. Herd immunity basically means we've created a wall of people who can't catch it and then spread it, so that the folks that can't get a vaccine are still protected.
God, it's like people don't understand that. They don't look past the soundbite. Okay, I know that we are down to our
It's okay. I want to make sure that we get to the question. So I've actually texted the person.
Well, okay. So the next question you actually answered about was your notes that you put in there. Next, what if we jump to what do health professionals think of the vaccine?
Most health professionals are so relieved. I mean, I know health professionals right now so I know a group at a local hospital, and they had not rolled it out yet. These guys were so desperate for vaccine that they went to another hospital that they had privileges at that they hadn't worked it in 20 years just to get the vaccine.
Yeah.
Right? I know people who cried tears of joy when they got that first vaccine.
I can imagine.
Right? Because it was finally, I want you to think about the folks that are seeing COVID patients, and every day they're walking and going, is this the day that I get something that could kill me?
Oh, God, yeah.
Is this the day that I get something that could kill me?
Yeah.
Is this the day that I get something that I could bring home to my mom or dad or my husband or my kids and kill them?
Yeah.
Right? So while we know that now that we have PPE, we can be more diligent, nothing is 100%, right? There is no 100% guarantee you won't get COVID outside of never seeing anybody, right? So, yeah, so this is a huge, sort of like going to the abstinence explanation. The only way to guarantee that you don't get an STI or pregnant is abstinence, right? Right? So it's a little bit like if you lived in a world where condoms didn't exist and someone invented condoms.
That's a perfect analogy.
Right? So for us, we understand it's not perfect. We understand that we can still get sick. I mean, there was an ER guy who had COVID like a week after he got the vaccine. That is not because the vaccine didn't work. The vaccine, had not had a chance to completely work, and he'd only gotten the first dose.
That leads me to a question I wanted to quickly ask. I've heard percentages, but after the first vaccine, how immune are you, and after how long does that take? And after the second, the booster, then how? So
it's about 2 weeks for both Moderna and Pfizer.
2 weeks for it to kick in.
2 weeks, yes, for it to be at full efficacy for that first shot.
Yes.
But full efficacy is like 40 to 60% efficacy.
For the first shot. Oh, yeah.
Yes. For the second shot, it's between 94 and 95% for both.
Yeah.
And again, it's still 2 weeks.
Yeah.
But that's true of most vaccines. It's the same with the flu.
So if I got the, I mean, I'm trying not to get my hopes up and be as realistic as possible. So I'm imagining, I'm just guessing I'm going to get this. Alexa, how many days are there in April? I'm imagining I'll get this April 30th.
Has 30 days.
I'm imagining I'll get this April 30th.
The first shot.
The first shot. And so it'll take 2 weeks.
So depending on which vaccine you get,
yeah,
right? It's going to be anywhere from 5 to 6 weeks before you've achieved full immunity.
Oh,
right?
Okay.
Because you'll get the first shot, and then either at week 3 or week 4 you'll get your second shot, and then 2 weeks after that.
So it's just like I've been saying, like I'm not ready to even let myself imagine that I'm going to be out and about and have any kind of freedom from worry until at least June 15th, and even then, even then, a vaccine is not an absolute guarantee that you won't catch. It still requires.
Well, it's predicated on a couple assumptions, right?
Yeah.
So one of those assumptions is that we get our shit together and that everybody gets vaccinated as aggressively as possible, because viruses like time. Mutations occur because the virus is still around and because it has time to mutate.
Yeah.
So is it possible that between now and May, a virus will mutate and the vaccine will not work? It is possible.
Yeah.
That's why it's so important that everybody who can get vaccinated gets vaccinated. I'm just going to make one more comment about the distrust of certain communities.
Mm-hmm.
On top of the distrust that we have that they rightfully have with the medical community, we've now added the burden to Black, Indigenous, and people of color in the healthcare profession to model good behavior. They have now had to take on the burden of being like, look, I've gotten my shot. I mean, I first of all think it's ridiculous that we become a society where everyone is taking pictures of their vaccine card or them getting a shot, right? I think that's absolutely insane. But given that information, a lot of my colleagues who are Black, Indigenous, and other people of color are feeling more pressure to make sure that they advertise this within their own communities, because, again, you're much more likely to trust someone in your own community. But that's just like another burden that we've added to people of color.
Yeah. I have a question. My friend Jason Hungerford, hey Jason, up in Ithaca, he's asking, this is a question that's coming in via Facebook comments right now. He said, first of all, thank you for doing this. Sorry if this was already covered. Do we know how long immunity is supposed to last after getting the vaccine and accompanying booster? So I know that we know how long it takes to kick in. Do we know yet how long? Yeah, we don't.
We don't, because again, it's going to depend on things like how quickly can we get rid of the, and when I say, I think the problem is sometimes the language that we use in short form in medicine confuses people.
Yeah.
So we'll say things like, it depends on how long it takes to get rid of the virus. And so people think that we think the vaccine physically gets rid of the virus.
Yeah.
And that is not what we're saying. We're saying the only way that the virus goes away is if we stop the ability of it to spread to people and replicate, right?
Yeah.
If we don't give it a host, then it cannot continue to survive.
Yeah. Yeah.
Right? So I don't know if you watched Stargate SG-1, but the Goa'uld are the parasitic race, right? If you do not give them hosts, they're going to die, right? So that's the goal here, right? Is don't give them a host. That's what the vaccine does. So it's not that the vaccine physically attacks a virus or anything like that.
Mm-hmm.
So how long it takes to go away, we cannot know, because we're not just looking at the U.S., right? We have to look at globally, right?
Yeah.
Because let's say they don't roll out in Japan very well, or they don't roll out in Russia very well, right? Unless those people are just going to stay in those countries, theoretically, they could still spread it to us, right?
Yeah.
So we don't have a great sense. We hope that it is at minimum going to be like a year. We hope that the mutation does not occur. But is it possible that SARS-CoV-2 vaccines become like the flu shot, where every year we have to get a new one based on the most recent
I
things?
should say
it's possible.
so. Oh, I should say so, absolutely. I mean, and I'm a layman, but just basing this on nothing else, basing this on people's behavior, I can only
Well, I mean, we just don't know, right? Like, coronavirus isn't exactly like the flu, right?
Yeah.
I mean, there's multiple different gene reassortments that occur with influenza A and influenza B and things like that. So it's not exactly the same. So we can't really translate it. We just don't know right now.
Yeah.
We do know that it has mutated a couple times. This most recent one makes it a little bit more infectious. Like I said, it's likely being here much longer than this week. It's just that it's made the news this week, and because we're testing for it finally.
And speaking of which, whether or not we end up having to have a different annual vaccine for it, I've already decided. I've spent almost a year now getting used to wearing a mask. I'll tell you what, I'm not stopping wearing a mask just because
we
I
may
get the
become like a
second.
lot of Asian countries,
Yeah.
right? A
Yeah.
lot of Asian countries have been doing this for quite some time. Now they're doing it for pollution,
Yeah.
right? Certain cities in India, you'll see people wear face cloths all the time because of pollution.
Yeah.
So I plan on going forward where I always have a mask in the car.
Yeah, definitely. I just, the idea that I could be vaccinated and someone else chose not to get it, and that they could have a mutation of it, or that enough people exposed me to it that
Yep.
why wouldn't I? In the words of
Right.
Michelle Visage, it's a piece of fabric. Like, why would I not just add that
Yeah.
layer of protection? Really quickly, I know that we've got one last question left. It's kind of a doozy, and I feel like we've sort of chipped away at this, but
I feel like there were other questions. Were there not other questions?
there was one that I wrote
Was
in
that
there.
everything in the Google Docs?
Yeah, there was one in
Oh,
there
okay.
that I wrote in there, but you kind of covered it. Was about the difference between them. There's one that
Oh.
actually I could circle back up to because it will probably be the super short answer. That one is from Jordan Daniel Mills. Hey Jordan, what other animals does this COVID infect besides just humans?
So we know that we've seen cases of it infecting dogs and cats, and cats include domestic cats and big cats, like in
Yeah.
zoos.
Yeah.
So one of the things I do always recommend to people is if you test positive for COVID, use the same processes you would use in your house to separate yourself from humans. Use those same processes to separate yourself from non-human animals.
Okay.
So as an example, I thought I had COVID. I woke up one night, like after an entire night of chills, and I'd had some GI discomfort. And I was like, I don't know if I've got COVID. I ended up testing negative. It was the antigen test, so it's not 100% positive. It's not 100% accurate, but based on my symptoms and lack thereof, in talking to a colleague of mine who I trust, who's an infectious disease physician, we decided I didn't have it. But anyway, for the next couple of days, just to be safe, I didn't kind of kiss on the dog, and I made sure I wore a mask, and I washed my hands before I touched his food bowl. And I didn't hug him and stuff. And I mean, yeah, your companion animals don't understand why you're doing that. But I would rather that than them get COVID.
Yeah.
Right?
Yeah.
To mine, I'll be honest, I don't know if any animals have actually died from COVID. But I don't want to take a chance that finding a new host, a new animal host, which is a lovely way for viruses to mutate,
Yeah.
that they end up getting a particularly virulent strain. There's
Yeah.
no evidence that they can give it to us.
Yeah. And I do think I heard ferrets as well, or mink. Or they were saying there's.
Mink, yes,
mink,
of course,
that was
yes,
the other
yes, yes,
one.
yeah. There's the
Have you heard
whole
of
thing
mink
with
farms?
mink, and they're killing them, and yeah.
Yeah.
But I mean, we killed 30,000 turkeys last year in South Carolina because of a brand of avian flu, and there's the fever in China where they killed millions of pigs. So
Yeah.
I mean, this again goes back to this idea of using animals.
Well, if you have time left for one last question, this one comes from my friend Punkage. Hey, Punkage. What do we know?
You're breaking up there. I do
Oh.
have time.
Okay. This one comes to me from my friend Punkage, who asked this question in the comments on Instagram. So I just want to give him a shout out. What do we know about this new COVID-19 variant B117? Is it anything like the B52s? I'm just kidding. No, he said all indications point to it already spreading rapidly in the U.S. And so here are his 3 questions he lays out, or 2 questions rather. So 2 questions about that. 1, when can different age groups of healthy folks expect to receive the vaccination? And 2, Both the current vaccines are multi-dose spaces 2 weeks apart. How are vaccine administrators keeping track of adherence to the schedule, and how are they ensuring that a person receives the correct vaccine in the second dose? What behaviors can a vaccinated person indulge in without risking vulnerable populations?
Okay, so
He
I
wants you
think
to
we
write a
covered
thesis
the whole
now.
we covered the whole B117. It
Yeah.
is not it is more infectious, but
Mhm.
there's no evidence that it's causing more severe disease. So it can spread and infect people better and more efficiently, but there's no evidence it's causing more severe disease.
Okay.
The problem, though, is just from a numbers standpoint, if something that we know can cause severe disease spreads more rapidly, then that risks more severe disease. Do you see what I'm saying?
I think I've been seeing people say that it's more transmissible or more contagious and more lethal.
There's
that
not
be
yet evidence that it's
Yeah.
more lethal quite yet.
Unless you define
Again,
lethal
because
as...
we haven't been tracking it, right?
Unle-
We haven't. It's
yeah.
only been this week that we've been going, oh, this person has the UK
Yeah.
virus, right? And I'm just saying that jokingly because we have
The
administration.
UK virus. Oh my God! Right.
Like I'm saying that jokingly.
If we're gonna
but-
be consistent, I
Right.
ask a question? I wonder if could it not be contextualized that by more lethal they mean more number of people infected.
Well, that's what I mean.
Yeah.
That's what I mean. So if something is spreading more rapidly and that something is known to cause severe disease,
Yeah.
that means that more people are at risk of getting severe disease.
But not more
because
lethal
it's
to the
spreading more
individual.
easily. Right, exactly. But
okay.
it's not like regular COVID is 50% lethal and this is 80% lethal. I mean,
Okay.
neither of them is
Yeah,
50%
yeah.
lethal, but you get my point.
It's
Yeah.
just a great example of how you can take one word and get two completely different stories out of it if you don't know what
Right.
you're talking about. If you're
Right.
not qualified
Right.
to know what you're talking about.
Right. And then the other questions were really excellent. So go
Yeah.
through them again, the
So,
ones that he had asked.
So when can different age groups of healthy folks expect to receive the vaccination?
Okay. Oh, by the way, I'm gonna correct Bunkage. It is both vaccines are not dosed 2 weeks apart. One is 3 weeks apart and one is 4 weeks apart, right?
Okay.
As we said earlier.
Yes.
I don't. I'll be honest with you. I haven't really looked into AstraZeneca as much. I know somebody had a question about that. The
That
major
was
way
mine.
that AstraZeneca is different is that the AstraZeneca vaccine is not an mRNA vaccine. It's much more standard in the way that it works. Basically, what they've done is they've taken a chimpanzee adenovirus, meaning an adenovirus that has been known to infect chimpanzees, but doesn't really cause disease in humans. And they've inserted a vector into that, a plasmid vector into that adenovirus DNA, and then they inject you with that,
Mm-hmm.
so that vector can use your cellular mechanism, your DNA mechanisms, to produce, immune, portions of the virus that you would then be immune to, or that you would develop immunity to. So I'll be honest with you, I haven't really looked at the AstraZeneca one because it hasn't been something I've had to counsel people on.
Mm-hmm.
So I don't remember if it's like a 3 week apart dose or a 4 week apart dose, or if it's just I think this one might be the one-time dose, or that maybe the Novavax. I can't remember. Novavax is now in phase 3 in the U.S. So that's another one that's coming down
That's
the
a
pipe.
fourth
But
one.
anyway, yeah, there's like 8 of them. There's like the Inovio one, there's Novavax, so there's a lot of them. But anyway, so again, this goes back to this idea of no one is scrambling to make flu shots in this way, right? So that's why we were able to rapidly come up with them.
Yeah.
So the question of when you can get it, honestly, is who the hell knows? And the reason I say that is because because there hasn't been a normal federal rollout. There hasn't been a functioning system of rolling this out in a controlled way. I mean, I read about this woman, like, on the one hand, awesome that she posted that she took it. There's some vegan model in San Francisco who got the shot, right? And I'm like, awesome that you posted that you got the shot and you're vegan, but how the hell did you get the shot, right? And apparently people asked her that, and she was like, well, I'm EMS trained and I have asthma. I'm like, well, asthma's not an indication, so I'm not sure how you got it. I don't know if it's because you know people, which isn't cool. I mean, how did freaking Marco Rubio get the shot, right? I mean, he's young and he's been saying this whole thing's a hoax, right?
Oh.
So unfortunately, it's not clear to me. If you live in New York, you're likely to do a better job just because, you know, what's his face? Oh my God, why am I blanking on his name? Not de Blasio. Who the hell is the governor? Cuomo. I mean, the guy's a jackass,
yes.
but he has actually done some good things. I mean, yes, he used the cover of the pandemic to cut Medicaid and all these horrible things that are inexcusable. But he has been rapid in his response to the COVID pandemic, right? So hopefully, once Trump is not there to kind of create roadblocks because he just doesn't like the guy, you know, things will roll out better. As far as how do you get it, I left my card in the car, but if you go to my Instagram, you'll actually see that I posted my card. And so everyone gets a card. This is literally it's the same no matter it's the same no matter who gets the vaccine and where they get the vaccine. So I have friends who've gotten the vaccine at their own clinic, at their own hospital, all over the country, and they get this card that's printed out by the CDC, and it says not only which vaccine you got. Did you get Pfizer? Did you get Moderna? What, you know, it gives you the date and it gives you the lot number on there. Most people are not allowed to leave. So what's happening because of this these anaphylactic reactions that have been reported with both vaccines, more so with the Pfizer than with the Moderna. It's important to realize that everybody who has had an anaphylactic reaction has a history of anaphylaxis.
Okay.
So people are going, oh my God, you can be anaphylactic. I'm like, I mean, yeah, if you have a history of it and you carry an EpiPen, you are more at risk. But what they have done in response, I don't know anyone who's gotten the vaccine who hasn't had to sit there for 15 minutes and be observed. Because if you're going to have an anaphylactic reaction, it's going to be in the first 15 minutes. That was the most stressful thing to me because I was like, I'm going to freaking get COVID just sitting here in this waiting room with other people who've gotten the vaccine because they want to watch me, even though I knew I wasn't going to have a reaction because, you know, knock on wood, I don't have anaphylaxis to things. So, you know, before I was even allowed to leave, I had to make an appointment for the second one. Now, if for some reason I don't make that appointment, I mean, there are other options. I can go to the Department of Health. I mean, I can do that because I'm a healthcare worker, right? So I can do those things if I need to. But eventually, when it rolls out, it will be a thing where you will likely not be able to leave after getting your first shot. They're going to observe you, and during that time, you'll make an appointment for shot number 2.
Okay.
Was that it? I felt like there was another question.
He was asking how vaccine administrators keep track of adherence to the schedule. We got that. How are they ensuring that a person receives the correct vaccine in the second dose?
Well, so again, it'll tell you whether you got Pfizer or Moderna. So if you have a card that says Pfizer, they're not going to give you Moderna. In fact, the important thing to do ideally is just go back to the center where you got your first one, right? Ideally, you're not going to go somewhere else because you don't know what they have, right? So you don't want to go to a center that only has Moderna and show up with your Pfizer card. They're going to be like, go away, go get a Pfizer vaccine.
And the very last question that he asked is, what behaviors can a vaccinated person indulge in without risking vulnerable populations? And I would assume that we mean someone who's received the second vaccine and the 2 weeks has passed.
So again, I'm still gonna remind everyone the vaccine is not a guarantee that you will not get it. So unfortunately, until herd immunity has been achieved, we still have to behave like we're in lockdown. We still need to socially distance. We still need to avoid unnecessary travel. We still need to stay in our homes. We still need to wear masks. We still need to wash our hands. And again, remember that's because all the vaccine does is it decreases the chance that you are going to get severely ill. And it decreases the chance you'll catch COVID. But it's not a zero. It's not like a guarantee that you're not going to catch COVID. So let's say I get vaccinated and I get COVID after the 2 weeks after my second shot. I can still get COVID and be asymptomatic, right? All it means is that I am less likely to get severely ill if I get it. If I do get symptoms, they're likely to be mild. But it doesn't mean that I can't still be an asymptomatic carrier. We do not know the rates we don't know what it's doing for decreasing the risk of asymptomatic carriage
and transmission. Is what we're
unfortunately,
saying by that.
right, exactly. If you're asymptomatic, you're transmitting it, right?
Oh my God.
So unfortunately, it means that getting the vaccine still means, it can't. The parties can't be happening.
And if you're asymptomatic, you don't know that you've got it, and you don't know that you're transmitting it. And if we have this
so
false
unfortunately,
sense of,
it doesn't mean great. I can start dating again. I can get on Grindr. It doesn't mean any of that stuff, right?
Yeah.
I said that right? Grindr. I don't really use dating.
Good for you.
So I don't know, but yeah.
It's missing a vowel.
It's just, right, but it's one of those things that I think a lot of people are thinking, I'm going to get the vaccine and I can just do whatever I want to. You can't, because you can still pick it up at the store, have 0 symptoms, and then bring it home to grandma.
And this, I feel like this might make me sound like I'm too much of a worrywart, but let's not forget that this thing can survive outside the body on surfaces. So even if you are completely bulletproof immune, you could still touch something that had it on there and spread that. Touch that, and then, oh, hey, lady, you dropped your phone here, and boom, you've just spread it to someone. I know that seems...
and then they touch their phone to their face. Or,
I know that seems
that
really
kind of
unrealistic, but really, how unrealistic is that?
No, I mean, again, people aren't just all getting this vaccine because they're coughing on each other, right?
Right.
They're getting it because they're touching stuff and then touching their face. It's both things, right?
Yeah. The way I am being regarded from other gays in the hookup community, because I am on Grindr and I am on the apps this entire time, and I'm like the old curmudgeon who's just stop doing what you're doing, and everyone's like, it's fine, I have antibodies. I'm like, what does that even mean? And I am seeing on Instagram, they're sharing it in their stories. I'm gonna plug at Gays Over COVID on Instagram.
Oh my God, I love that account.
Oh my God, did you see?
I don't know if this person is a man or a woman, but whoever they are just like, oh my God, I am gonna name and shame.
And I'm not ashamed to say, I named and shamed myself. I saw someone on Grindr the other day. They're taking no precautions. He's on Grindr. He still lists his Instagram. In his Instagram, he's sharing in his stories. He goes out to a party.
That.
Yep. And then
one of the guys in there is either a pharmacist or a medical student or something, because I could see a white coat.
Oh, and that wasn't
by the way, weren't we supposed to talk about the pharmacist? Somebody had a question about the pharmacist who got arrested.
I don't think I heard about that.
Yeah. That was what your friend Sarah was asking about, the pharmacist who got arrested for thawing the vaccine.
Oh, the one who left out 500 doses of it? I didn't know that would be a pharmacist.
So I think we answered that question, because that goes back to the question of how are health professionals approaching this. And sane health professionals are, you saw how they reacted, right? They fired this person.
I hate to ask you to speculate.
I don't know what their motivation was.
I was going to say, I hate to ask you to speculate, but why would someone who works even adjacent to this field do something deliberately that's so stupid?
We've seen crazy things. Come on, I know psychiatrists who are super Christians who would recommend conversion therapy.
Oh, God.
Right? So people do really, really horrific things in the name of their own beliefs, whether that's anti-science beliefs, whether that's ridiculous religious beliefs, whatever the case may be. I can't speculate on that. I was fortunate in that I was raised I am religious, and I was raised in a Hindu house, but I was raised by a scientist, and my medical school made it very clear, despite the fact that it was in the deep South, or at least I shouldn't say my medical school, my mother made it very clear that your religious beliefs stop at the door.
Yeah. Oh, yeah.
Right? You live your life the way you want to live your life. Right?
Unless that involves going to Puerto Vallarta.
You don't do things based on your own personal beliefs, other people. Unless those things are fundamentally, I do understand someone who is pro-life not being willing to perform abortions. Fine, don't perform abortions, right? I understand that philosophy. But yeah, I can't speculate. I don't know if this person was just there's embryo cells in it, I'm destroying them. I don't know if the person's just having a mental breakdown.
I just want to throw in, this is sort of about what I said earlier, but it doesn't exactly tie into where we're at right now, but among these people I'm seeing who are just throwing caution to the wind and partying, I'm seeing people who they're posting their pictures as a, I'm assuming, nurse or healthcare worker getting their vaccine, and then you look
Right.
at all of their stories and all of their Instagram feed, and they're like, stay home, save lives, wear a mask, like please stop stealing our PPE, like we need the N95s, blah blah blah. And
Right.
then you're seeing like days or a week after they get the vaccine, they're in Puerto Vallarta at some circuit party dancing shirtless with 1,000 other guys in no masks.
Right. So I don't know if that's the difference between and again, so I don't know what kind of nurse they are.
Yeah.
Are they a primary care nurse who doesn't understand immunology and doesn't see critically ill patients?
Yeah.
Are they I mean, and it's not just nurses. I mean, not that I'm seeing physicians do this, but that's not true. I do know one physician who did this, which I'm actually surprised. But anyway, I think that you'll always meet people in every field who maybe this person didn't go to a good nursing school, right? And so they didn't get the same training that someone who went to an academic center would have gotten. Maybe they did like an online degree, which is totally different and cannot compare to an in-person degree, right?
Wow.
Maybe this is somebody who, like, I can tell when a physician has been trained in a community center versus an academic center for the most part, because I can tell who is better able to keep up with the literature, who is critiquing the literature in a certain manner. So I think that most people who go into critical care, they have to be really good at doing those things, right? Because things change constantly in critical care, right?
Yeah.
You have to be able to critique the literature, and if you don't feel comfortable critiquing the literature, you have to be able to know how to go to the Society of Critical Care Medicine to look at the guidelines and practice based on that, right?
Yeah.
But you may not be doing that if you're like a nurse practitioner or a nurse in family practice at a regular. I mean, I'll tell you, my friend Felice is a family practice physician in Charlotte, and because she takes care of underserved and uninsured people, she has to know more than the average primary care physician does, because her patients don't have the luxury of going to subspecialists because they can't afford it, and because a lot of subspecialists minimize the number of uninsured or Medicaid patients they'll take, right? So she'll call me sometimes, and I'm like, I can't even believe you're doing all this work, because in my world, the primary care doctor would have been like, vaguely lung-related issue, go to a lung doctor.
Yeah.
Right? Whereas she's actually doing the work and doing all the stuff that I would be doing because she doesn't have a choice, right? So it's to her benefit because she's one of the smartest doctors I know, but not every doctor has the luxury of doing that, right? If you're a primary care doctor seeing 100 patients a week and someone comes in going, I'm short of breath, and they've done it for the third time, yeah, I can understand why you'd be like, whatever, I can't figure this out, go to a lung doctor.
Yeah.
Right? You may not want to go, well, let me get a chest x-ray, let me get lung function tests, let me trial you on some inhalers, because you just don't have the time to do that. Now, Felice doesn't have the time to do that either, but she also doesn't have a choice, right? So she is doing those things. So it's, so I think it's very hard. I think that what people don't understand is that people are still people at the end of the day. Right? So just because you're a physician, that like all physicians don't agree on Medicare for all, right? All physicians don't agree on a lot of things. And so I think I know physicians who are Trump supporters, right? So it's one of those things where unfortunately sometimes your personality can dominate the science, And if you're not someone who is trained in an academic institution and works in an academic institution, and is so for example, I don't know a single lung transplant nurse who would do anything without talking to the lung transplant docs, right? In this situation, right? They go, you're the expert. Yeah. Tell me, is it okay for me to go on vacation?
Yeah.
You know what I mean? So I'm gonna guess, I don't know what kind of nurse this person is. Are they a CRNA? Are they an RN? Are they an LPN? If they are an LPN, are they an LPN in a pain clinic? Are they an LPN in a rehab center? Are they an LPN with access to a critical care doc or an ID doc? Because I can guarantee you, no infectious disease nurse worth their salt should be doing this.
Right. I mean, it just sounds like there's the root word of practice is practice, and it sounds like there's all sorts of different ways somebody can actually be practicing medicine, such that they're either going to be disciplined or they're going to have a very personally undisciplined approach And yeah, it's I don't think it's what's bothering me about this is there's so many people who will contradict what I'm saying online, and what I'm saying comes largely from having talked to you and talked with other doctors and nurses, and they'll be like, oh, so what's your qualification to say this? Are you a doctor? And I was like, no, I'm not a doctor, but I know a lot of people who are healthcare professionals who say stupid stuff that I'm like, I happen to know that that's not how that works. Like I told you, there was someone on my profile on Grindr and Scruff. On Scruff, you can write a novel, and I did in your profile. In Grindr, it's like less than a tweet. It's like 140 characters. And so I changed it to just say like, COVID antibodies don't make you immune.
Oh, right.
Got questions? Ask me. And this person, no, I said COVID antibodies don't mean you're immune. You can still get and transmit the virus. This person was furious at me, and like, just like that's absolutely ridiculous. How could you possibly spread a virus that's no longer in your system? I'm like, I've not gone to medical school. Can you hear how much you're assuming in the way you're phrasing this argument? Like, yeah. All I said is you can't guarantee someone you can't transmit it. And this person was like, I mean, this person was being extra. I tried to screen record the conversation, but I couldn't before they blocked me. But like,
yeah,
I was just like, can you just pay attention that like you're heated, and if and that like there's no need, and they're like, you deserve to be yelled at this way, like you're gonna get people killed. I'm like, for telling people to err on the side of caution and that they should
right,
not.
That never made sense to me. I was like, how are you getting people killed by telling them to stay in their house? Are you expecting the roof to cave in on them?
Yeah,
like, what's
this
happening?
person was like, you obviously don't care about the hundreds, the thousands of people who are gonna die because of what you're saying. And I'm like, just
yeah. I mean, I remember we talked about that, and I was like, nobody in the history of ever has ever died from being celibate.
Well,
like,
I mean, hey, that's not true. What if thousands of people stayed home because I told them to, and then their apartments blew up or the ceiling caved in? Right. You'd have to include it in the study.
No, but I'm saying specifically, nobody in the history of ever has ever died from not hooking up.
Yeah, well,
right?
Yeah.
So, but going back to what you're saying, I think I'll say this and then I'll end it because I told this person that I'd be done by about 5:30, 5:35. Right. So I think it's important for people to understand that immunity is not a catch-all phrase, even though we kind of use it that way. Again, this goes back to medical abbreviations, right? Mm-hmm. We talk in terms because we as physicians understand what we're saying, but sometimes the layperson doesn't hear it. Like an anecdote that I use often is, I will routinely ask my patients when I come in, what brings you here today? And half the time they'll go, oh, my daughter drove me. And I'm like, oh, okay, you misunderstood that question, right? Because theoretically, you could interpret my question to mean physically, how did you get here?
Sure, yeah.
Right? So a lot of times I have to be like, no, I'm sorry, this is what I actually meant, right? So I think what people don't understand is, as an example, you get the virus, okay? You get sick. Your body starts to produce antibody. It starts to produce IgM first. Okay? There is a theoretical window. It's actually a real window, but I don't know how long that window is, where you're going to have virus and IgM in your body at the same time. Right? So you have antibodies. If you took an antibody test, it would be positive, but you still have virus and you're still infectious.
Wow.
Right?
Yeah.
Then, once the IgM goes, once the IgM has been produced, then you start producing IgG, right? So IgG, as an example, tells you have been exposed to something. When we do antibody titers, that's basically what we're testing. We're testing IgG. So, like, I had to get a varicella vaccine last year because after 40 years, I lost immunity to chickenpox from when I had it as a child, right? And that was based on my titers. I had no IgG in my system anymore. So once you get the IgG, the difference is for something like for something like measles, okay? We know that if you have been immunized for measles, there is no evidence at this time that immunity wanes. There's no evidence that the B cells that produce those antibodies and the T cells that have helped to create immunity goes away. Contrast that with whooping cough. We know that you need a booster every 10 years
Mhm.
because the immunity wanes.
Yeah.
Same thing with tetanus.
And because
Right?
we've had that much
So what
time
we-
to study that.
Right. And what we do know about COVID is that we are seeing cases of reinfection.
Mhm.
Some people are getting reinfected and getting sicker the second time around.
Mhm.
Okay, so we know that the immunity is not permanent. My brother had antibodies in March, I want to say, and then when he got retested, he had no antibodies, like 3 or 4 months later.
Yeah.
Right? So anywhere from 4 to 6 months. Like I saw somebody posting in Vegan Atlanta that they were fine because they had COVID in August. And I'm like, that doesn't mean you're fine at all. They were like, well, we want to go out and blah, blah, blah. And other people were like, don't do that. This is a pandemic. And I just stepped in when they said this thing about antibodies because I was like, I don't want people thinking that that's true.
Yeah.
And then it was really bizarre because then the story changed totally to some bizarre thing that was like, well, no, I mean, we're driving into Atlanta and I work for an infectious disease doctor and we've only had 5 cases here and it's because we're all masking and blah, blah, blah. And I'm like, who cares what's happening where you live? You're driving into Atlanta. You should care about what's going on in Atlanta, right? Because she was using that as a justification for why it was safe for her to come to Atlanta because wherever she lives in Podunk, Georgia, there aren't that many cases. I'm like, right, but you're about to come to COVID Central.
There aren't that many people in Podunk, Georgia.
Well, no, but I mean, maybe in that area they really are being effective and people are wearing masks, and so maybe they don't have that many cases. She's like, we've had 5 cases at our hospital. I'm like, but how big is your hospital?
Well, and they're also not doing there what you're about to go and do here by driving into Atlanta.
Right, and driving to an area where there's a lot of COVID and a lot of spread, right? And then the other thing is, I don't know how big your hospital is.
Mm.
There are many hospitals that the moment you hit the door to the ER, it's like, oh, too sick to be at our hospital, go up the road to another hospital.
Yeah.
So maybe that's why your hospital only has 5 cases, right? So it's like, I don't understand what you're saying. We've literally reopened for the 3rd time the Georgia World Congress Center for COVID cases, right? We've opened a gigantic conference center and turned it into a makeshift hospital.
Yeah.
So yeah, I mean, anyway, we could go on forever. It's very frustrating.
I know that we're at time.
Yeah, it's been incredibly disheartening.
And I hope that's where we leave people, is that, like, yes, there's a lot to be hopeful for. Please do not interpret that hope to mean I can go back to, quote, normal.
The hope that people should have is getting vaccinated decreases your risk of death.
There we go.
Right? And it decreases your risk of severe disability.
Yeah.
It does not, and it decreases your risk that you'll get infected. It's not a 0 risk, so you can still spread it.
Yeah.
We still need to be wearing masks. We still need to be doing all of this.
Yeah.
Until the CDC and the NIH say, we're good, we're not good.
Mm-hmm. I couldn't say it any better than that. That's so perfect. If nothing else, I'm going to memorize that last 30 seconds as a speech and just say it to everyone, especially back in Wisconsin, those people who want me to come back and visit. And I'm like, nope, I'll see you in 2022.
I mean, hopefully it's not going to be that long. Hopefully we achieve herd immunity and by the summer things are stable. I don't want to say get back to normal because normal has pretty much been sucky for a lot of people.
That's another
in general.
context.
But
hopefully this new administration will roll things out correctly and they'll fix a lot and we'll get back on track.
Yeah. But as soon as you are able to get the vaccine, I would strongly encourage you to get the vaccine.
I already let my doctor know. I'm like, if you need someone to test on, I will throw myself on the needle.
Yeah. Well, I mean, Novavax is still recruiting. I don't know if anybody in New York is recruiting for Novavax.
Mm-hmm.
I know, at Emory, they've started. I'm actually surprised. Not only at Emory have they started the Novavax phase 3 trial, but Del Rio just tweeted out that the Ponce Clinic is actually a center. So the Ponce Clinic is like this phenomenal HIV center in Atlanta.
Mm-hmm.
So it must mean that they're trialing it on HIV patients. Which is good, right? I mean, obviously there are HIV patients, and so we need to know how the vaccine is going to work in HIV patients. So that's a really good thing.
Yeah.
So yeah, I mean, I think we can do another one in a couple of weeks after I get my second shot if you want to, because
Sure.
I fully anticipate that I'm going to have more reaction to that.
Yeah.
Typically, when I get a flu shot, I get fevers and I get achy, so I just take some ibuprofen.
Yeah.
I did take 800 of ibuprofen after I got this shot because I didn't want the fevers and the muscle aches.
Yeah.
I knew it would be sore locally. I mean, I knew that was going to happen. And it was for about 24 hours, and then it was
Yeah.
fine. And I'm fully anticipating fevers and achiness and fatigue and all of that stuff. But I think it's really important to understand that a 24, 48-hour fever and myalgias, meaning muscle aches, is not COVID.
Yeah. Yeah.
Right?
Yeah.
It's like when people go, I got the flu when I got the flu shot. I'm like, did it knock you on your ass? No. Then you didn't get the flu.
Yeah.
I mean, forget about the fact that you can't get the flu from the flu shot, but
I know healthy people who have died. I know healthy people who have recovered and who have lost their lung function. I mean,
who was the Broadway star who was super healthy, who first lost his leg and then he died?
I don't know. I haven't heard about this.
Nick Cordero. Nick, am I saying that right?
I know that name. I don't think I knew that this. Oh, I
Yeah,
did
he died
hear about this.
He died I mean, he was in the hospital for 4 or 5 months.
I did hear about this. Yeah. Oh.
And yeah, I mean, fine, you could argue maybe the guy wasn't vegan. I know vegans who've gotten sick, who've gotten very sick. Again, not eating animal products decreases your risk of the comorbidities that put you at high risk, and they may make your immune system stronger.
Yeah.
There is no evidence that the abstention from eating animal products prevents the virus from binding to the ACE2 receptor.
Yeah.
I mean, if there is, I will be the first one shouting that from the rooftops, right? To get people to go vegan. But unfortunately, avoiding animal products does not prevent the virus from binding to the ACE2 receptor.
Yeah. I could say so much more, but I don't wanna keep you any longer.
Yes.
But yeah. Well, thank you for that, and let's.
Sure.
I would love to do a follow up when you know that you're gonna get the second shot. Maybe we can schedule.
My second shot. Well, I know when I'm getting it, right? Because they didn't let me leave without getting my appointment. So it's on the 14th is when I'm getting my second shot.
Oh, okay. All right. So maybe we can plan in advance and set another date.
And then 2 weeks later, I'm gonna throw a huge party. I'm just kidding.
Oh God! I was like, not you too.
Yeah. No.
Oh.
But 2 weeks later, I am gonna go, probably the day that I get my thing, I'm gonna go get some vegan junk food.
I was just gonna say, I'm like, oh, I might get some ice cream.
Yeah, I'm gonna go get some vegan junk food.
And Patty Stein just said, thank you so much. This was so informative. And
Sure.
Gloria Bonilla said, heroes, all of them, thank you.
Well, I mean, I just want to say to everybody, please do be careful. Please continue to wear a mask.
Yeah.
Continue to physically I don't like the term socially distant, right?
So,
I want us to be physically distant, but I want us to be social.
Yeah.
Help out the folks that are struggling. Oh, I forgot to do this. I was going to do this, and then I forgot. If anybody's listening to this and found value in this, I'm going to ask people to please consider making a donation to Vegan Meals That Heal Inc.
Right. I'm going to put this in the comments.
And on Instagram, that's at Vegan Meals That Heal. This is a phenomenal organization in Atlanta. It's a 5013C, so it's tax deductible. They'll send you a receipt if you make a donation. But you can go to their Instagram, which is at Vegan Meals That Heal. Please do consider donating. This is a woman who in 2019, before the pandemic started, because and I'm not sharing anything that she doesn't share, she has been housing insecure. She has been food insecure. She was at one point living in her car.
Yeah.
And she decided that nobody should have to live that way. And so she makes vegan meals or gets donated vegan meals and passes them out to people who are living in tents under highways, to people who are struggling to get food, to people, and she donates, she uses donated clothes, she goes and buys blankets as well from the dollar store and things like that for people in the winter. She creates hygiene kits. So she's not just providing nourishing meals to people, she's really providing the concept of dignity, right?
I love that.
Because I think what a lot of people who are poor feel ashamed, and poverty is not the shame of poor people. Poverty is the shame for us, right? That's our shame. That's not their shame that they're poor.
Oh,
So
God,
she
yeah.
so
That
so
took me a
she
second.
does a phenomenal job. So I'm just gonna ask people if they felt like they got value out of this.
Yeah.
If you would please consider making a donation to Vegan Meals That Heal, that would be awesome.
Yeah, I just put their name in the chat along with their Instagram handle, and I asked people if this conversation made a difference for them to please donate.
Awesome, thank you.
Awesome. In the video when I post this, I'll make sure to actually put that in the
Awesome,
caption
thanks.
so it's right up front.
Yes,
Awesome. Thank
yeah.
you so much. We'll talk to you in about 2 or so weeks.
Yes, all right.
Thanks again.
Bye.
Bye-bye. All right. All right. Stop.